I'm joined by local business, not-for-profit, healthcare, faith-based leadership for a very important announcement related to the COVID-19 virus and its impact on Winston-Salem. Today, we as a group are announcing a new initiative called Mask the City to help reduce the spread of the COVID-19 virus here in the Winston-Salem Forsyth County area. The purpose of the Mask the City is to provide everyone, and I said everyone, in Winston-Salem access to a mask and to urge them to wear it, as well as to continue social distancing for 40 days. We hope to begin incrementally relaxing some of the restrictions on our community, and this initiative today will help us facilitate those decisions. I'm extremely proud of the Mask the City effort because I believe it will bring our community together for a common cause that will benefit us all. The masks that we are distributing beginning today were designed locally by Dr. William Satterwhite, who's the Chief Wellness Officer at Wake Forest Baptist Health, and his team. The masks are being produced locally as well by the Renfro Corporation, which has the ability to make approximately 900,000 masks a week when they ramp up to full production. And Renfro has earmarked the first 300,000 masks for Winston-Salem. In fact, the first shipment of 25,000 masks arrived yesterday afternoon, and the distribution is already underway. And today, the masks will be widely distributing throughout the community beginning today under our Mask the City program. Renfro is selling these masks, which they call the Nightingale WS Protective Mask, at a below market rate for this kickoff event. According to preliminary tests, these masks offer an excellent protective barrier and reduce the likelihood that anyone who's wearing this mask will not generate or share their germs with someone else. And this mask can be washed up to 25 times without degrading its effectiveness. Now, many local businesses and organizations have already committed to purchasing the mask for their employees, and the mask will also be widely available to those who are in need in our community at no cost from a fund that's being administered by the Winston-Salem Foundation. In fact, we hope to provide up to 60,000 masks to those individuals who are living at or below the poverty level in our community. And you'll hear more about that in just a moment. Right now, I'd like to ask Dr. Satterwhite to tell us more about this mask that he and his team designed. Dr. Satterwhite?
Yes, thank you, Mayor Joint. I want you all to catch the vision for this mask and the whole Mask the City effort. It was just 29 days ago that I assembled some of my team and I said, look, there are not going to be enough masks, not enough masks for healthcare workers, not enough masks for people in the city, and we have got to address that. Within 5 days, with their leadership and help from other departments within Wake Forest Baptist and Innovation Quarter, we had our first prototype. Within 10 days, we had connected with Renfro Corporation, who also has space in Innovation Quarter, to design masks that would be effective to be produced on a huge, huge scale. By 15 days, those masks were already being made so that we could test and try them out. And I want to show them to you. They actually are incredible, incredible masks. So some of the design features they have created are, in essence, what we call a breathing pocket. Using the nice contour of the nose and the chin, they actually have material that moves out away from the face. If you've ever worn a mask for a long time, it gets hot and wet if it's close to your face. So they created the technology and engineering to do that. They added nylon straps, which are tied behind the head, which are incredibly comfortable, which matters if you're wearing a mask all day. And also, they work much more effectively at creating a snug fit than something like ear loops do. And finally, people like me have already hacked the mask and added a few pipe cleaners in the middle to give me more tightness around my nose so my glasses don't fog very easily. A stunning accomplishment in just 29 days. And I will tell you, some of this happened on the design side. Some of it has happened because of the leadership of this city. This is an amazing city, an amazing community. It was only 7 days ago that I actually reached out to Don Flo and the mayor and said, I got an idea and I think it'll work. The idea is this: can we mask the whole city in 1 week? 300,000 masks. Renfro can make them. They can make that many. An incredible partner. And they are willing to have that be their first run off the plant floors. Let's get everyone behind it and do it. And that is what has happened. Everybody on this call is part of that journey. And we want you to be part of that journey too. We are going to say life with COVID-19 is going to look differently. And we are going to show the state and the nation what that is like. So let me introduce you to Stan Jewell, who is the president of Renfro Corporation and who has been a fantastic partner to work with as we have gone down this path over the last 29 days. Stan, go ahead.
Thank you, Bill. You know, when Renfro first learned of the need for protective masks, we tried to think of the best way to use our assets to help out. And Renfro is the largest sock manufacturing company in the United States. And with so many retail closures, we had available capacity. So the demand for socks has been diminished, and we needed to reuse that capacity. For the past 4 weeks, our entire product development team has been focused exclusively on how to produce masks on our own equipment. Rather than simply making a mask, we wanted to use our 99 years of manufacturing expertise to create a truly superior mask. We teamed up with the folks at Wake Forest and Dr. Satterwhite's team to develop this reusable mask with excellent protective qualities, exceptional comfort, as he pointed out, and it's washable and reusable. The fabric is made at our factories in Tennessee and in Alabama, which together employ more than 1,000 people. At full capacity, we expect to be able to produce about another 500 additional positions to help assemble the mask. These are people that otherwise would not be working at this time. We're working with other companies in our communities to help fill some of these positions. The mask assembly is completed in Tennessee, Alabama, South Carolina, as well as in Mount Airy, just up the road. We partnered with another local company called Tampco to create tools to help in the assembly process. We have truly pivoted as a company and scaled up the production of masks, and will soon have the capacity to produce nearly 1 million masks per week. We're so proud to work and live in a place where business, government, and other civic leaders work in such a collaborative manner. And we are excited about participating in the Mask the City effort. I offer a big thanks to Dr. Satterwhite and his team for helping to develop this product. It's been a real pleasure working with you. And with that, I'd like to introduce you to Dr. Julianne Freischleit, who is the CEO of Wake Forest Baptist Health and the Dean of the Wake Forest School of Medicine.
Thank you, Stan, and good afternoon. It's such a privilege to be here virtually with all of you, and we are always committed to keeping our patients, their loved ones, and our staff safe. That's why we wanted to be involved in this project. As the largest employer in the area, we saw this as a great opportunity to support the health of our community, and we are honored to join with the City of Winston-Salem, Novant Health, and countless businesses and organizations throughout our community. We are so grateful to Dr. Bill Satterwhite and his team in our health and wellness group for their innovation in designing these masks alongside Renfro. We are fortunate to have such a talented group on our team here at Wake Forest Baptist, and it's no coincidence that this effort came together in the Innovation Quarter. Bill's team is located in Bailey Power Plant. Renfro also has an office in the same building. Innovations such as this happen when brilliant people are put together, given a challenge, and then work together. This is exactly what happened here, and that's why it's so important to continue to cultivate our innovation ecosystem here in Winston-Salem. At Wake Forest Baptist, our employees and their families will have access to these masks so they can wear them while they're out and about doing essential activities such as grocery shopping. In addition, we have ordered extra masks for our patients who may need them when they arrive to our facilities. Over the past month, I've been so inspired to see how people in our community have come together to serve others in this time of need. Hundreds and hundreds of people, including family members, many of our own providers and staff, have devoted their time, their energy, and their talent to sew masks, and we want to recognize their commitment and thank them for all they've done and will continue to do so. By all of us working together, we are helping to keep our friends, neighbors, and loved ones safe. By wearing a mask, we can protect others around us. But it is important for us to remember that this project does not replace the stay-at-home orders and social distancing guidelines that are still in place. It is still very important that we continue to practice good hand washing and hygiene habits, just like we always should. I'm proud to be part of the Mask the City, and I know that if we all continue to work together to take care of each other, we can continue to keep our community healthy and safe. Now I'd like to introduce Novant Health Executive Vice President and Chief Operations Officer, Jeff Lindsay.
Thank you, Julie. Good morning, everyone. It's a pleasure to be with you here today, although I recognize we've all had to adjust our definition of what being together means. Novant Health exists to improve the health of the communities that we're privileged to serve, and that's why we're here today. Stopping the spread of COVID-19 will take the commitment of everyone across our community. Masking is something we can all do to enhance the success of the things we're already doing. Staying home, washing our hands, and social distancing, particularly when it's necessary to be around others, buying groceries, visiting pharmacies, and seeking health care. A community commitment to wearing a mask will also protect the workers who continue to show up day after day to feed us, care for us, and keep us safe. I want to join Dr. Freischlag in being clear, masking will not replace hand washing, social distancing, or staying home, but it is another powerful tool that we can all use together to speed up our journey on the path to recovery. I also want to acknowledge the community efforts that sprang to life weeks ago. Thousands of community members contacted us wanting to help, offering to sew masks. So Project Winston-Salem, a group of more than 1,500 dedicated members of our community, have already provided more than 27,000 masks to healthcare workers and the most vulnerable among us, including this mask made by my own mother for me. We're inspired by their activism and believe in this initiative. That's one of the reasons Novant Health has also committed to provide masks for the safety of all our team members and patients. I'd like to acknowledge that Winston-Salem hasn't been hit quite as hard by COVID-19 as other areas around our state. While that may seem like a reason to quickly relax our social distancing measures in the hopes of returning to life as usual, the opposite is true. The measures we're taking are working. We're protecting ourselves and each other. If we stop doing these things too soon, we'll reverse the progress we've seen in controlling this virus. As co-chair of Greater Winston-Salem, Inc. and the Chief Operating Officer of Novant Health, I share the community's concern about the economic impact of business closures, stay-at-home orders. They've impacted our friends and neighbors across our entire community. I balance that also with recognizing the economic and social impact of allowing this virus to spread uncontrolled across our community. We're all eager to get back to our routines. On behalf of Novant Health and our 12,000 team members dedicated to caring for this community, I ask you to join us in masking the city. United, we can stamp out the community spread of COVID-19, save lives, and reopen our community. And now I'd like to introduce Tembala Covington, President of the Ministers' Conference of Winston-Salem and Vicinity.
Ms. Covington, please proceed. Ms. Covington, this is Ed McNeil. Can you hear me? Please begin, ma'am. Please welcome Mark Owens from Winston-Salem, Inc.
Thank you, Ed. I'm sorry for those technical difficulties, Pastor Covington. We appreciate the Ministers' Conference and all that you're doing in part of Mass the City. As the CEO of Greater Winston-Salem, Inc., we're honored to participate in our business community is stepping up in so many ways. So many of our companies have already made this possible by purchasing masks for their employees, their families, and in many cases, the community at large. There's also contributions coming in for those among us in need. And we're so excited about the opportunities. I want to thank Don Flo for the vision and drive to push us forward, and everybody on this call for putting in extra time and energy with the goal of making our community as safe as possible by masking, staying at home, and having social distance so that we can get back to our normal routines as we talked about. Obviously, we're excited to get back to work in some way, shape, or form, and we're all working hard to do that. And these masks are a step forward in that process. And it also shows the togetherness that our community can truly have. And we're so thankful for all of our businesses stepping up. We have some exciting things to share that small businesses will be able to purchase masks via maskthecity.com starting next week. There's be more details on social media at the handle @maskthecity. This is going to take all of us, and we're in it for everyone. And over 300,000 masks will make sure that there's some available for everyone. And we're asking people to just take one of those. Businesses can also purchase in large quantities directly from Renfro, and individuals will be able to purchase starting this Friday at Winston-Salem area's Lowe's Foods. Our entire business community is coming together. We have groups such as The Mixer making face shields and bands, Hanes Brands and others that have stepped up, and Renfro, we're so thankful for your leadership in making this possible for our community. It's an exciting time to be in Winston-Salem, and this togetherness is going to take us forward and strive to even be better as a community when we come together. So please consider getting involved in Mask the City, maskthecity.com or @maskthecity. And we look forward to involving all of our community together to move forward. So with that, I'd like to return to Mayor Joines to close and even potentially bring in back Pastor Covington if possible. Mayor?
Thank you, Mark. And I'm sorry, Elder Covington's hookup was not working there. I'll cover some of her points and hope she can get back on there. But she's going to really talk about the free distribution program that we're going to be doing using various nonprofit organizations, churches, and organizations such as that. The Winston-Salem Foundation has set up the Mask the City Winston-Salem Fund, which will be used to provide a mask to various organizations for the distribution. The primary focus will be on organizations who are assisting and reaching those with current incomes below the federal poverty guidelines, as I mentioned earlier. And a secondary focus will be to healthcare workers. Those who would like to contribute to this fund, the Mask the City Winston-Salem Fund, should go to the Winston-Salem Foundation website, which is wsfoundation.org, #MaskTheCity on their website. And Dr. Covington was going to mention that we're asking individuals to just take one mask when the distribution is made around the community there. So let me again thank Dr. Satterwhite and his team for this wonderful effort in coming up with this mask. I want to thank Renfro for their ability to pivot quickly and create the foundation and the ability to make these masks.
Good afternoon, everyone.
And we'll be moving forward with that. I want to thank the leadership of our 2 local healthcare organizations, the business community, governmental officials, the faith-based organizations, and other not-for-profits who are helping to unite our city under this Mask the City program. As Dr. Flastag mentioned and alluded to, as did Jeff Lindsay, I want to also give special recognition and thanks to the more than 2,000, as I understand it, local volunteers through the Project Mask Winston-Salem who've made over 25,000 masks for the healthcare industry and others. I want to call out the names of Marissa Joyce, Melissa Vickers, and Katie Lee, who've created this grassroots effort that we're actually building on today. These selfless volunteerisms have come together to cut and sew masks in their own homes in recent weeks was part of our inspiration for this effort. The fact is that our community can use every mask that we can get our hands on, and I urge everyone to continue making those masks. The need is enormous. I'd like to ask our citizens to continue to support this volunteer group contributions can be made to the Love Out Loud program and help with the cost of buying materials. I understand that Dr. Covington may be back on the line there, so if so, I'd recognize Elder Covington for remarks. Well, apparently we don't have her, and we'll continue on. So right today, I, as the mayor of the city, am seriously challenging every person in Winston-Salem to continue practicing social distancing and to add wearing a mask every time they go outside to help dramatically reduce the spread of the COVID-19 virus. And in doing so, help us hopefully to be able to reopen our economy a little sooner. 30 to 40 days are a critical time, but we must remain diligent, as many of our speakers have already said. I am confident that the citizens of Winston-Salem will rise to this challenge and this occasion under the Master City Initiative. This is our time to shine for all of America to see as we adopt a new normal until a vaccine is developed. Nightingale mask, other masks, as well as the practicing appropriate social distancing, and remain as crucial elements of our strategy to keep this virus under control. And at such time as our city does begin to reopen, it's likely we will need to continue using these tools for some time. The tagline for Mask the City is this: wear a mask, love your neighbor, protect yourself. It's imperative that we continue to do this for 4 days to protect our community and hopefully change the trajectory for our city in the near future. The members of the media, we are happy now to begin to entertain questions. If you would state the organization you're with, as well as perhaps identify the speaker that you would like to have address your question. So first question.
This is Wes Young of the Journal. Can you hear me okay?
Go ahead, Wes.
Okay. How much are the masks going to cost? The ones that aren't given away, how much? What's the price on those masks? I don't know who would answer that.
I think Stan Jewell can comment on that.
I will. Obviously, this is it moved very quickly, and we earmarked these first masks for the city, as Mayor Joines referred to earlier. What we're going to do is provide a website for anybody that has any interest in the mask to be able to visit this website. It's called nightingalesafe.com. And if you visit that, you can state your interest, your level of interest, your organization you're with, and we'll have some sales executives and other executives be able to get back to you to talk about the quantities you need, the purpose of the mask, and the distribution efforts that we can make to get those to you. And at that time, we'll work with you on the pricing of those masks. So that, once again, that's www.nightingalesafe.com.
So is there a retail price? Like I see that, they'll be available at Lowe's or something. What's the retail price?
So the effort at Lowe's is not really a retail effort at this point. That's just another point of distribution for us in the Mask the City effort. And the Mask the City effort is not intended for retail. We wanted to focus on this community effort first before we really focused on retail. So we'll be changing our attention towards that and more business-to-business opportunities, business to other governments, business to enterprise, and direct-to-consumer efforts. So we have not actually set pricing on this for individual consumers yet. After this Mask the City effort is complete, we'll be turning our attention towards that.
So is the idea then that the 300,000 masks for the city of Winston-Salem, are most people going to get their masks for free through some organization, like either their business or a nonprofit?
Is that probably a question?
Many businesses have bought masks for their employees as well as employee families, and then we're taking some other outside the box steps to make sure those 60,000 individuals can receive masks at no cost to them as well. All right, next question.
Yes, this is Danny Finnegan at the Triad Business Journal.
Yes,
And this question is for Dr. Satterwhite. I was wondering if you could tell us a little more again about the design of the mask and the timeline that you discussed earlier.
Yeah, sure. Thanks, Danny. hopefully you can see me now wearing the mask, right? This is going to be the new normal, right? Even though no one is in the room with me, I'm showing you what it's like. Yeah. So be more specific on what you want to know.
What are the special features of the mask? You mentioned that it makes it easier to breathe with it.
Yeah. So one of the things that Renfro was able to do was really to help create a mask that not only was close to the face here, but away from the face in the center. So if I breathe in real hard, you can see that, that's essentially a pocket that allows easy air exchange and also keeps it away from your mouth. When you wear a mask for a long time, if it's close to your face, it gets wet because you're exhaling. And so it gets hot and wet pretty quickly. This actually keeps that from happening quite well. And in essence, gives a place for the air to go and sort of an air chamber to breathe through. The other things that are particularly appealing about it are just the material itself. It's incredibly comfortable on your face. It breathes well. It's flexible. One of the things you'll find out if you enter into the mask design business is people's faces are very different. And if you design the perfect mask for your face, it's not going to fit thousands of other people very well. And so one of the things that works with this particular design and this particular material is it's very flexible and moldable to sort of run with your face, whatever that's like. And then the fact that they have nylon ties, which have a little bit of stretch, but you can also make tight, is really important because people's heads are also different. Some are round, some are flat in the back, some, like mine, just don't have quite as much cushioning as everybody else's. And so having those features is very helpful just purely in the comfort and fit of the mask.
Thank you. Next question, please.
Hi, this is Sayaka from Triad City Beat. I would like to know what the masks are effective for. As far as some of the research and reading I've done, my understanding is that regular masks like these that are not N95 masks are effective for those wearing them to keep their germs to themselves, I guess, and to keep from infecting other people, not necessarily to keep them from getting coronavirus or COVID-19 or what have you. So if someone could talk a little bit about what the masks will actually do, that would be great.
Dr. Satterwhite, I think that's yours.
Yep. Happy to take that on. Yeah, it's a great question. So you're absolutely right. So the primary function, far and away, of any kind of face mask is it keeps me from being able to share my expiratory respiratory droplets, if you want to get kind of technical, with other people very easily. So normally, if somebody is breathing out, just the pure wind current from that is going to carry several feet away. And if they cough or sneeze, it can go 10, 15 feet, a long way. And so the main purpose of any kind of mask is it actually keeps me from being able to share that with you, whoever the you is out there. That's the number one thing. Now, it's not a perfect seal. It's not like an N95. An N95 is a technological marvel, actually, that it seals very, very tightly, and you can still breathe through it because those kind of work against each other, and it filters well. In this case, all other masks are essentially saying they're going to be a barrier, keep me from sharing with you. Now, at the same time, if you're wearing a mask, it does make it harder for you to receive respiratory droplets and airborne aerosols from me as well. So it's a double protective layer if everyone wears them. And that's one of the reasons it's so important as a city and community to say, wow, can we absolutely mask everyone within a week's time? Because now we've created this huge level of protection that should decrease the effectiveness of germ sharing, which is really what we want. And there's studies that talk about that, how it's effective for that. It's not perfect, but it's another layer and helpfulness. It's a great question.
Thank you, Dr. Satterwhite. Before we get to the next question, I'm going to recognize Elder Covington and love for her to say a word from the Ministers' Conference. We're so delighted to have the Ministers' Conference working with us on this. Elder Covington.
Thank you, Mayor. As I was saying earlier, and I do apologize for the disconnection, the Ministers' Conference is truly honored to be part of this project. And we definitely want to be a part of a great project that helps to supply free masks to our community at large. And what I wanted to share earlier is to everyone that this distribution will be free, and the distribution will be free through our nonprofits as well as through our faith organizations and churches. And so we're truly excited to be part of it. I know a lot of that information has already been shared, but thank you so much for the opportunity to be a part of such a grand and wonderful opportunity to heal our city right here in Winston-Salem.
Thank you, Elder. And the Ministers Conference has worked with us on many, many projects in the future. And I can tell you they're a very effective organization that gets things done. Next question, please.
Hi, this is Taylor Newman with Spectrum News. I was just wondering, when are people going to start being able to get these masks?
We're starting the delivery today. Actually started a little bit yesterday, but starting today, and we'll be continuing to ramp up every day. Next question, please.
I have a question. This is Marina Leman with Que Pasa. And I'd like to know if you have a list of organizations that the Chicani community can go and get the mask.
You're asking what organizations would be available to provide the mask. Elder Covington, can you take that one, or is there someone else who'd like to touch on that one? I'll unmute your phone there. We've lost the audio from Elder Covington. We'll certainly have a list of those organizations available on the website in the near future. We'll get back to you on that one.
Okay, thank you.
Question, please.
Hi, Mr. Mayor. It's Wes Young again. Listen, I was curious, for someone who's not in that free distribution category, if I want a mask, is there a number I can call? What should I do?
See, not sure who might want to take that one, but I think we've got so many of our companies have already signed up for thousands and thousands of these units. We'll have to develop that system, Wes. But anyone else want to comment on that?
Mr. Mayor, this is Mark Owens. I can try to help there with maskthecity.com and our social media at maskthecity will help provide more information as well as some releases here. We're trying to distribute through our companies and our businesses and our community, as well as many of our nonprofit partners. We Love Out Loud, YMCA, the Ministers Conference, and more. And just to refresh, some of the masks will be available through Less Foods in the Winston-Salem area for sale. But of course, we're asking people to stay at home. So if you're going for your essential items, they will be available there. But we are asking people to continue that stay-at-home order. And Mr. Mayor, I'll just take the liberty real quick. I forgot to mention just a special thank you to our public health department, our public health director, and our EMS folks that have been working alongside our medical committee. I just wanted to bring that reference up as well at this moment.
Thank you, Mark. Good point. Next question, please.
David Ford with WFTD Radio.
Yes, David.
A question for Dr. Ohl. I last night spent several hours reading responses to a Facebook post. It was, if you're not wearing a mask, covering your face with something when shopping, can you tell me why? This is someone born and raised in this area. She had close to 300 responses, comments, and I'm wondering if you could kind of address some of the big anti-masking concerns that you're hearing, that you've been encountering just over the last month or so.
Well,
you're directing that to Dr. White or to
Dr. Ohl?
Yeah.
Oh, Dr. Ohl. Yes.
So there are some people who can't wear a mask because of medical reasons, usually underlying lung problems, asthma, severe claustrophobia, and things like that. That number of people is small. I think there's a group of people who are against masks because of the psychological effect of feeling like things aren't normal or different. And then there's a group of people who just don't like being told what to do specifically. I'd be curious to see what you found reading those Facebook posts, but most people medically can wear a mask. The longer you have it on, the harder it is for some aspects, which is why it's important that masks be comfortable and well-fitting, so that it's easier to do so. You know, the one thing is we start thinking about relaxing where we're at now with shelter in place and social distancing. As the mayor said, we need to have some things that we can do that will help mitigate risk or keep us safe while we're going about doing this. And while masking is one thing, there's a lot of other things as well. Part of it has to do with putting a barrier up between your nose and mouth and your hands, because when it's the respiratory droplets, and when those get on the hands, then they're on your hands, and then you touch somebody, shake hands, give a hug, something like that. That's an opportunity for the virus to transmit. It also keeps it out of the environment and off of fomites and things like that you might touch with your hands as well. So having that barrier up around your nose and mouth is helpful. And then let's say you shake hands with somebody and then you touch your face, your nose, or your mouth, that is a transmission to you. If you have the mask in the way, it's a barrier for that. And then lastly, and it's been alluded to in the call, is a mask kind of puts us all in one big community where we're sharing with what we're going through with. And it helps and remind us of the other things that we should be doing. Staying 6 feet away, social distancing, not getting together in groups, washing our hands frequently, and all those other things. So having the mask on goes beyond just the physical containment of particles.
Thank you, Dr. Buell.
Mayor, could I ask a follow-up question?
Yes, go ahead.
I had a couple of questions. First is for Dr. Ohl and Dr. Satterwhite. Would you be able to explain to our viewers what proper mask wearing protocol is? When do you need it? When do you not need it? And when you are wearing it, when should you take it off? I think there's a good deal of confusion about, okay, I'm in my car now, I'm not in the grocery store, so I can take my mask off. I'm outside, so I don't need it. Now I'm inside the store, I should put it on. Could you give us sort of a nuts and bolts dummy version of when exactly you need a mask and when you don't need a mask?
Right.
Sure, I can take that, Kenny. The areas where it's most important is when you're in public areas where social distancing might be difficult. So a grocery store is a good example. A corner market, a convenience store, places where there's going to be other people around, where it's not a large facility, for instance. Those are the important areas. So if you find yourself in situations where you just can't physically stay apart from people, then that's an area where you'd want to think about. When you're by yourself, well, such as all of us on this call right now are in our own spaces. None of us are wearing a mask, and that's okay, because this is our environment, it's our personal environment. But there are times in the household when you might want to do it, particularly if you have been told to isolate, or if you're in quarantine and you're in a household situation where other people in the household may not have been exposed yet. It's going to be really important for you to segregate yourself in the household and then use a mask whenever you leave your segregated area. Because it's really important. Households are one of the big areas where transmission occurs. Now, if everyone in your household is well and you've been doing social distancing, sheltering in place, you really haven't been out and about, do you really need the mask at home? Probably not. But certainly if somebody's been sick or told that they need to isolate or quarantine, that's the time. Lastly, I get a lot of people asking me, do we need to wear it when we're outside, out and about, riding our bike, jogging, running? In those situations, there is so much air movement around us, and the air disperses the droplets and the aerosols fairly quickly, and also UV light does its bit to chew up on the virus a little bit. So Do we really need to have it outdoors? Not unless you're in a situation like on the Greenway where there's a lot of people around, and it seems crowded. So a little bit, it's common sense.
Dr. Ohl, thank you. And if I could get one follow-up to our hospitals as well, Julianne and Jeff, could you each kind of paint a picture of what you are seeing right now in the city, in the county with respect to COVID-19? We are trying to explain to our viewers what's going on. We report the numbers from the Department of Health and Human Services every day, but I think there is still sort of this feeling that, okay, it's only X number of deaths, it's only X number of cases, this isn't New York City, so we're going to be okay. I fear that there is that sort of mindset that exists. So if Julianne and Jeff, if you're both still on the call, would you be able to just paint us a picture of what you are seeing in Triad hospitals with respect to COVID-19 at this very moment?
Sure, I can do first, if that's okay, Jeff. I think Dr. Ohl has taught me the word mesa, that we've actually seen sort of a flattening number that are getting admitted. However, we haven't done extensive testing. We are getting more testing capabilities so that we can test people that come in with symptoms and our healthcare workers on the front line. But it does look like it is stabilized in the number being admitted to the hospital at both our institutions. However, that's probably due to great social distancing and paying attention to everything that we mentioned in our presentation. So as we go forward, we're hoping to keep it that way. We probably will have COVID-19 around us for a long period of time. We just have to figure out how to deal with it and how to make it work. Different parts of the state have had different numbers, certainly down in Mecklenburg County and where there's more population, and in Wake County there's been more. But ours has really been relatively stable with few deaths in the Triad.
Yeah, this is Jeff Lindsay. I would just add that in our hospitals, we're seeing, as Julie said, a pretty steady number of admissions that's not surging up in the ways that we've seen in some communities that have so stressed the healthcare systems in the communities. And the reason I believe that we're not seeing that is because this community's done a great job of putting in place social distancing and staying home and washing their hands and being thoughtful and careful about their interactions with our friends and neighbors. And that makes all the difference.
Thank you, Jeff and Dr. Fleischstein. Next question. Must have covered everything then. We greatly appreciate you joining us this morning. We're excited about the Mask the City project. Again, I challenge all of our citizens to begin wearing a mask as soon as we can get them out, and wear them for the next 30, 40 days, and let's really slam the door on this virus. Thank you so much.